Hi, I'm Tracy Larson, the Pediatric Trauma Program Manager at Regions Hospital, your Level 1 Pediatric Trauma Center. Did you know that child maltreatment is a common cause of injury in children? Today we're going to look at common injury patterns for identifying non-accidental trauma using a case presentation. Child maltreatment is a common cause of death and needs to be in the differential diagnosis of any children that are presenting with injuries or decreased level of consciousness. But no matter what the injury pattern, we need a detailed history. So let's look at some of the injuries that should raise suspicion. When a child falls, they should have a small injury or bruise at the site of impact. There should be a simple skull fracture if there is one and not a depressed skull fracture. And any delay in seeking treatment should raise red flags. When kids break their bones, they break the middle of their bones. Typically, they'll have a mid-shaft clavicle fractures or a humerus fracture. Long bone fractures in children that are non-ambulatory should raise red flags, as well as any type of a rib fracture. When it comes to tissue, bruising over the bony prominence of your children's, their knees, their elbows, and their foreheads is expected. But if there's a delay in seeking treatment and bruises in non-ambulatory children, this should raise red flags. Let's look at a case presentation of a 3-month-old that arrived through triage. Mom states the child rolled off the couch, cried, but has been more irritable since last night. Through more examination, Mom states that she was actually out running errands and the child was alone. Mom noticed a bruise to the cheek, and Mom's not very concerned about child abuse, but did notice some bruising a few days ago. So let's look at the exam. There was bruising noted over the right cheek and petechial rash to the eyes and bruising over the nasal bridge. So we did a head CT and found an acute subdural hematoma, which prompted us to do a bone survey where we found not only several fractures, but healing and acute fractures of the child's bones. So let's go back and look at our list. We have a red flag of multiple injuries with a very short fall of rolling off a couch. Can a 3-month actually roll off a couch? It was unwitnessed, and it was a delay in seeking treatment till the next day. Let's look at the skeletal. We have fractures of long bones in a child that is 3 months old that technically should not even be able to sit up yet. And again, a delay in seeking treatment. Then there's bruises in a non-ambulatory child. All these red flags, we had multiple consults. Being a Level 1 Pediatric Trauma Center, we are required to have the resources to take care of these children. This child spent 3 days in the hospital and was able to be discharged home with foster parents. So remember, child abuse and neglect can be physical, psychological, or both, and child maltreatment should be considered in any child that presents unconscious or with injuries. And getting the injured child to the right Level 1 Pediatric Trauma Center that has all the appropriate resources will improve patient outcome. Thank you.